My name is Gary. I'll be 57 this year. I've been living with chronic pain for around 30 years.
My name's Stephen Rose. I'm a proud Gunditj Mara man. I've had chronic pain for 22 years.
I'm Dr Hester Wilson. I'm a GP and addiction specialist working in Sydney.
I'm Penny Wood. I'm a pharmacist. I work in Aboriginal health for Watherong in Geelong.
How did you start taking opioids?
How did my journey with pain start?
How should opioids be ceased?
What are the alternatives to opioids for chronic pain?
I had a series of back injuries. This pain is constant, like someone's got a hot knife and slicing me in places.
It's a sharp pain, it's there all the time. I live with it 24/7.
What's the worst thing about it?
I have no life.
Living with chronic pain is a drain. This kind of pain stops me from interacting with my family, stops me going on things that people would take for granted, like outings. I feel degraded about being in a wheelchair now. I feel that there is a big stigma about chronic pain. People judge you on what they see. They can't look inside me, they can't feel what I'm going through.
Yep, I get put on the fat and lazy. And I'd love to be working.
Yeah, I was on the opioids really heavy for the first 2 years.
I started taking opioids 22 years ago. No, I got them prescribed from my doctor. I am dependent on the opioids. If I didn't take them, I wouldn't be getting out of bed.
An opioid medication, how it works is it blocks the message of pain getting to your brain. So it doesn't take away the pain, it doesn't fix the tissue injury. The other issue is tolerance. So your body can get used to the opioids, and what you can find can happen is you need more and more and more to get the same effect, and all of a sudden you're on a massive dose, so it can be quite dangerous.
When I was really, really bad with the back pain, I would take up to 10 to 15 heavy opioids and then wash that down with a bottle of scotch or rum and still feel the pain. I'd be lying on the ground in pain still.
There are some really important risks of using opioids in non-cancer pain, chronic pain. The first thing is that in themselves they have side effects. So can make you nauseous, can make you constipated, can make you quite sleepy.
You can never take enough. It doesn't stop the pain. I found I'd always feel the pain in the back of my head. Even though I'd be really groggy, I'd be almost walking sideways in the walls, and yet it wasn't actually dulling the pain.
Yeah, side effects, I don't get much motivation because it's, sort of slows you down a bit.
So opioids can interfere with the respiratory centres in your brain and stop your breathing. We know it's really clear that as people increase their dose, so does their risk of coming to harm, particularly overdose.
Being dependent on the opioids, it's, like I know I need them, otherwise I can't walk around, but I'd love to where I'm not on them.
Stopping taking opioids can be really challenging. I've talked to a lot of patients and they've said it's been the hardest thing they've had to do in their life.
When I stopped taking them, I became angry because I was in a hell of a lot more pain. So that meant, I started smoking marijuana or pot, and that sort of didn't help things. So that's why I ended up going back onto the painkillers, onto the opioids.
Going cold turkey is a terrible thing to do. The shakes, the sweats.
The best way to assist people to start to cut down, to taper and to cease their medications, doing it collaboratively, together, over time, frequent reviews, lots of support, helping them to look at the other supports they might need to put in place once they start cutting their dose down.
Yes, I'm trying to get off the opioids because I'm just over it.
So I'm now on a pain patch, which is a very low opioid, and it gets meted out over a week.
There absolutely is evidence for the non-medicine approaches to chronic pain management, particularly talking therapies.
The non-medical therapies I have at the moment is still chiropractic. I see psychology services and psychiatric services because of the trauma of going through all these injuries and the pain that they've caused.
The best thing that will help me is going to the pool and walking in the pool to help me lose the weight.
Certainly Aboriginal medical services are expert at this, at helping people to access the care they need in a way that is culturally right for them.
The group that's helping at the moment is my local Aboriginal health service, and it's like a one-stop shop. They have like an allied health approach, and they bring everyone together and they talk to you and they listen to what your needs are as a person.
My experience in being an Aboriginal man is Aboriginal Health Service. They treat you with respect. They treat you as a person and not a number. And they actually care about you. I can sort of look back at my ancestors and my elders and see the struggles they went through and realise, what I'm going through is nothing compared to what they went through. So that, sort of helps me a bit.
Yeah, I finally feel like, yes, that at least now I have someone that will fight for me and talk and do the talking for me.
There needs to be more than just thinking a pill's going to fix your problem, because it's not. Straight out, it's not.